How can we use home monitoring of blood pressure to change medications for high blood pressure? My name's Paige. I'm an ambulatory care pharmacist, and I commonly manage hypertension remotely. In order to do this, I of course need values to evaluate the therapy that a patient is using. So for these patients, I will send them a blood pressure cuff, and I will provide them a few counseling points on how to check their blood pressure for appropriate evaluation. In preparation for monitoring of blood pressure, we want to counsel patients to avoid caffeine, any physical activity or strenuous exercise, and tobacco use about 30 minutes prior to them checking their blood pressure. We also want to ask for them to rest for about 5 minutes or more seated, not really doing anything to come down from any hustle and bustle that they might have been partaking in leading up to them sitting for their blood pressure reading. We want them to sit with a hard back chair with their back supported by the backrest of the chair, and we want them to have their feet both flat on the floor, their arm about at heart level, and the blood pressure should be placed appropriately on the arm. There are diagrams that we can reference on the blood pressure cuffs to counsel patients on the appropriate positioning of the blood pressure cuffs. With regards to how many blood pressures we want to be able to see a trend of high or low blood pressures. So typically about 2 to 4 weeks worth of readings is an appropriate time frame to evaluate. So in short, that is how I counsel patients to measure their blood pressure for me for interpretation at virtual appointments. Keep following along for more pharmacy and healthcare fun facts.